I'm Sophie. I'm a paramedic, and let's talk about serotonin syndrome. So serotonin syndrome, very simply put, is just an extreme excess of serotonin in our body. There's way too much serotonin running through our synapses, way more than it can handle, so things start to go a little haywire. And typically, the causes of serotonin syndrome are going to be medication or drug-induced. Medications like SSRIs, SNRIs, tricyclics, and, bet you didn't know this, maybe even Zofran or Reglan can cause serotonin syndrome. And when we are trying to identify if this patient has serotonin syndrome, one of the most important assessments and finding is going to be their history. Do they take any of these medications? Do they have any history of illicit drug use? What's their social history look like, etc. And then we're going to look at these three categories here: behavioral, autonomic, and gross neurological. So for their behavior, we're going to see agitation, restlessness, easily excited, easily startled. And then once we move towards the more severe serotonin syndrome symptoms, we're going to see like extreme altered mental status, altered level of consciousness, maybe even unresponsiveness or syncope. And then in our autonomic changes, everything's just amped up. So we're going to see tachycardia, hypertension, and even hyperthermia again as we move towards that severe side of things. And then lastly, our gross neurological symptoms. That kind of red flag, high alert consideration for patients experiencing serotonin syndrome is clonus. And then as we start to move towards more severe symptoms, then we might see things like seizures. So how are we going to treat this patient? For us, in the pre-hospital setting, this is going to be majority just supportive care. We're going to make sure if they need sedation, we're going to sedate them. We're going to make sure, if they seize, we're going to treat that with benzos. If they need airway support, things like that. It's just supportive care, fluid administration. Consider that this patient might be at higher risk for rhabdomyolysis because of this hypermetabolic state. So there you have it. That's the quick and dirty for serotonin syndrome. And if you have any questions, comments, or concerns, meet me in the comments.